Good morning. I'm Dr. Akram Al-Zubaydi. I'm an interventional pulmonologist at National Jewish Health and also the founder of EON. And just wanted to bring up the essential patient curves that we have today. And as we can see today, there is 1.8 million patients that were diverted in terms of office visits. We're up to 39 million, almost 40 million visits that have been diverted due to COVID-19. Diverted essential patients is close to 8 million and now 255,000 procedures missed. And procedures, those are just APC procedures only, levels 1 through 5. And I can tell you that in terms of bronchoscopies, office visits in my own practice, definitely see a decrease. However, it does look like there is going to be a ramp up back to opening of other service lines, both PCP, general pulmonary clinic, everything. Colonoscopies are going to be restarted. Looks like in May. Other service lines, bronchoscopies, everything. And so, as you can see, that we do have the diversion curve decreasing here on April 26th. That's just 5 days away to where there is going to be ability to see patients that are non-COVID patients that need to be seen. Our assertion is that you need to see the patients that have increased mortality and morbidity over the next 30 to 90 days if they're not seen first. So what we want you to do is to triage your patients, and the way that you can triage patients is with SafetyNet. And SafetyNet is what it does is that it analyzes radiology reports for actionable findings like pulmonary nodules, liver lesions, pancreatic cysts, AAAs, and we have a few other that have the ability to be cranking on different service lines that can identify patients who have abnormalities which may need to be seen. Now, the cutoffs for what's essential and what's not essential may be different based on if it's a pulmonary nodule, for example, and it needs to go to surgery. There was some guidance before that it was 2 centimeters or above. This Thursday, though, tune into this brief, and we're going to have updates on what the new guidelines are going to be for actual for the actual nodule patients and your pulmonary nodule and lung cancer screening patients. Currently, what we see is that lung RADs 3 and higher are being brought in for their scans. Baselines are being diverted. Annuals are being diverted. However, we do see that in the next 2 to 3 weeks, those are going to be reopened. In addition, when it comes to incidental nodule patients, if a patient needs a diagnosis now for cancer, then that's a patient that you should try to get in safely. We talked about SOPs and standard operating procedures. Just make sure that you see your patients extremely safely and you have good throughput. Just wanted to talk about SafetyNet again. It's free until the end of May for all hospitals. We had an administrator who said, hey, listen, when things are free, they're usually not free. So what the deal is that we have a standard SLSA that you accept. It's very simple. We do accept your BAA with some red lines based on review from our side. There's a SOC 2 that stands in lieu of a security questionnaire. We're SOC 2, Type 2, HIPAA compliant, with a ton of controls that are with enterprise architecture that's been approved by some of the biggest IDNs in the country. And then if you get that in on a Friday, by the next Friday, you'll be activated on SafetyNet, where you start getting essential patient reports that include all patients who have been identified nodule-wise, incidental nodule-wise, from biggest to lowest. In addition, if you want to get EPM, EPM is always an option, which is our essential patient management system. And then also within 3 weeks, we're going to be centralizing management of those essential patients. So a lot coming. We want you, the main message is to make sure that you open your service line safely. Number 2 is triage the patients with SafetyNet that are essential that need to be brought in the next 30 to 90 days. And then use EPM for longitudinal tracking and centralized management, where you're going to have improved follow-ups. So looking forward to Thursday is the big day. Thursday is a release, and we'll go over the release of the statement that talks about who to see when it comes to the pulmonary service line. That's this Thursday. Otherwise, we'll continue to update you on a daily basis of the amount of patients that are being diverted. We are looking at reopening. A lot of sites are reopening their service lines, and so we're going to be monitoring that and giving you an update on the numbers as we go day by day. Thank you, everybody, and we'll talk to you guys soon.